Okay, we're going to wait one more minute. I saw Mike Sigler lurking outside, and Veronica's lurking inside. Okay, we have quorum. We can start. Welcome everyone to the October 17th, 2022 meeting of the Health and Human Services Committee. Are there any changes to the agenda?
Dan, yes, we do have the one change. So under housing, the two resolutions.
Meaning we have to flip the order. Yes, okay. Very good. We'll take care of that. Thank you. All right, we're up to public comment. I have Teresa Alt.
Hello.
You can pull that thing down if you get.
Does it work now?
It works just fine as long as you're comfortable.
Okay. I'm Teresa Alt, 206 Eddy Street, City of Ithaca. Here about the Dryden House project, and really all I have to say about the project itself is that it is desperately needed. So go for it. But I was intrigued by something in the memo accompanying from Elliot Benman, where it said none of the county's contribution involves local tax dollars. And it surprised me a bit because well, what better use could there be for local tax dollars than housing for the people who most desperately need it? And then I started to wonder, but then where did it come from? Federal, that's good. You know, fairer taxes based at least somewhat on ability to pay. State, again, taxes that are based somewhat on ability to pay. The Cornell contribution, okay, a lot of wealth behind that. Some others charitable source. I know there are these fees that developers pay the IDA, but I've noticed that they are tiny compared to the cost in missed county, city, and school taxes that take place when the IDA tax subsidizes a project. So this is really a kind of broad wondering about how the money flows. Thank you.
Thank you, Teresa. And I see that Megan McDonald put something in the chat that she will be happy to talk about the funding when we get to that part of the agenda. Sound good? Okay. I assume there's nobody else from the public on Zoom or anything? Okay, great. Anyone here from county administration to give us a county administrator's report?
Yes, I'm here. Thanks, Dan.
Okay.
I have another meeting that I'm double booked for at 3:30. So apologies for not being there in person, but I'm here long enough. I'm happy to provide a brief report from county administration. We're in the process this week. We were going to be reviewing respondents to the RFP that was issued for consultants for strategic plan. Again, this is a grant that we expect to be receiving from Southern Tier 8 to draft the county's first strategic operations plan. So looking forward to that process, and we'll be busy reviewing those RFPs this week. Also, we're moving ahead on utilizing a private security firm to provide armed security at the Human Services Building. We're moving ahead through the procurement process to put that into place. We also, throughout the budget process, came upon the fact that we expect to be that we are receiving $100,000 from the state in Dwyer funding for peer-to-peer support services for veterans. That's coming through the mental health department to veteran services. So we are we're preparing a resolution for grant acceptance, and that will be forthcoming through Health and Human Services to realize that funding in the county's budget. Not this month, but next month we'll have that for you. And then finally, just a mention, because it's come up at several times through this committee, that in the 2023 budget, the legislature looks to be funding a homeless coordinator to address overarching issues regarding homelessness, and including the encampments, to inform and coordinate the county's approach to serving the unhoused population. So, and that position will be in county administration. So I just wanted to bring that full circle back to Health and Human Services Committee. And those are the updates from county admin, and happy to take any questions.
Thank you, Lisa. Any questions? Mike?
Can you remind me why the homeless coordinator is going to be under administration, not under the health department?
Well, it really could sit in any number of departments, but the fact that the response will involve not only the health department, but DSS, the sheriff, the district attorney, it was thought that the approach could be better coordinated from a centralized location in county admin.
Anything else for Lisa? Anything else from Lisa?
That's it for me.
Okay, well, thank you. The chair's report, I'll just mention really briefly, Travis Brooks, one of our committee members, is traveling today, and so that's why he's not able to be with us. And wanted to mention that Veronica and Greg Mezzi and I met with our new housing planner that we all met at the committee last month, Elliot Benman. And we had a kind of a wide-ranging discussion about housing issues, and he will be coming to our meeting next month, and that'll be our topic next month, to talk about housing issues, to meet him a little more thoroughly, to hear about what we're already doing on housing issues and looking forward. So that's it for my report. Okay, we're up to the first set of resolutions. We're going to switch the order that they appear on the agenda. So the first one that's up is negative declaration for authorizing disbursement of the Community Housing Development Fund Award for Dryden House. Does somebody want to move that? Randy's going to move that. Thank you. Veronica seconds. Thank you. Okay, Megan, you want to lay it out for us?
Well, actually, this is Elliot's agenda item, but I figured I'd jump in just to address Teresa's question about the funding source the county uses for these awards. And it sounds a bit complex, but back in the day, the Department of Housing and Urban Development, HUD, used to provide community development block grants, CDBG money, directly to communities like ours. And the county for a long time ran a homeownership program. And depending on the funding year, oftentimes the homeownership assistance was provided in the form of a loan, a low interest loan that would defer payments for a period of time, and then give a low to moderate income first time home buyer an opportunity to then later kind of pay back our portion of that assistance. And so when the county received receives those loan repayments, that becomes what in the kind of housing community development world is called program income funds that must be used in a kind of similar way. So when the Community Housing Development Fund was first started, the county went to HUD and asked if we could use those funds that had been accumulating in our account towards this program, because it can be difficult for counties. We had not changed New York State county law at that point. So to use local dollars was a bit questionable in terms of what counties have authority to do, which is different than what cities and towns and villages are allowed to do. So that's a very long way of saying that we had these funds that were, kind of originate from assistance in the housing world for low and moderate income first-time home buyers. And so the county thought, it was an appropriate use to try to increase both the home ownership and rental opportunities that were affordable in the community. HUD agreed, and when we've gone back to ask them to let us use all our money in this way, they were delighted. Frankly, they've never seen a program that they've approved kind of produce so many units. That's not typically what they see. And so that's what we're currently using. Those loan payments, these are loans from decades ago. So the last loan payments are trickling in, and this funding source will end, which is why the county worked with our representatives to actually change New York State county law so that it's clear that Tompkins County specifically is able to use tax dollars, local tax dollars towards both the creation and maintenance and ongoing operation of affordable housing.
Yeah, thank you, Megan. The only thing I would add to that is that also, and correct me if someone knows more than this, if I've got this quite a little wrong, that we just changed our policy recently last year or earlier this year about the IDA funds, and that starting next year, we're going to have quite a bit of money from those developers coming into the community housing fund. Did I get that more or less right?
Yeah, it's actually the IDA's workforce housing policy. And although that was passed, I think it was in 2020, actually, yeah. Those funds don't start being paid by developers receiving incentives through the IDA until their projects are actually operational. That's why there's a time lag. And so we expect to start seeing the first of those contributions to the program later next year.
And it could add up to quite a bit of money. So that'll be a little bit of a game changer, or at least a different direction. Anything to say about any questions or comments from Megan before we move on back to the resolution? Okay, Elliot, would you like to tell us a little bit about this project and the resolutions we're about to do?
Absolutely. This is a project, an affordable housing project that was recommended by the Community Housing Development Fund Program Oversight Committee for funding. This is a 4-unit permanent supportive housing project located in the village of Dryden. It is for women and women with children experiencing homelessness. The recommended funding amount from the county is $70,000, and the town of Dryden has also committed $50,000 toward this project, and that's in addition to about $227,000 that the developer raised from private contributions. We have 2 resolutions. One, the seeker resolution to concur with the Village of Dryden's finding of a negative declaration of environmental significance, and then the resolution authorizing the disbursement of county funds in the amount of $70,000 for the project.
Great, thank you. So the first one is the negative declaration of environmental significance. Any questions or comments about that before we vote? Okay, let us have a vote. Mike Sigler. Yes. Randy. Yes. Veronica.
Yes.
And I'm a yes. That's unanimous. Thank you. Somebody want to move the second resolution, dispersing the funds? Veronica moves, Randy seconds. Discussion. Randy?
Yes, Elliot, is this a brand new facility or a renovation of a property or?
Yeah, so this is going to be a new construction. It's on a property where there was a house there prior, but it suffered damage from a fire and was condemned and demolished. And yeah, so this will be a new construction of 4 units.
Else before we vote? Okay, Veronica?
Yes.
Randy?
Yes.
Mike?
Yes.
And I'm a yes, that is unanimous. Thank you, Elliot. Thank you, Megan. Anything else before we move on from the housing topic? Okay, thank you. Next up is what is still called Public Health and Mental Health Departments. We have several resolutions and a little bit of a discussion report. So the first thing up is a resolution authorizing a public hearing on a local law amending Article 9 of the Tompkins County Charter to include the provisions of Article 16, effectuating the merger of the Public Health and Mental Health Departments. Somebody move that. Veronica moves. Randy will second. Thank you. Let's see. I think we have Frank Krupa with us. I think I saw him.
Yep, I'm here, Dan.
Frank, you want to say anything to start us off?
Just that this is the formal process of actually merging the 2 departments together. The legislature voted back in December of 2019 for us to move this process forward. And unfortunately, COVID slowed it down a little bit, but we're now back on track. And what you have in front of you is a draft charter amendment, essentially bringing most of the language that was in Chapter 16, which was the Mental Health Department, into Chapter 9 to make it one chapter. And it creates a new single department of whole health, which includes much of the same rules and requirements, including the 2 boards will still exist, the Community Services Board and the Board of Health. It does make reference to the new Commissioner of Whole Health, which is my position. And it also talks to the appointment of the 2 deputies, one at Mental Health and one at Public Health, in the event that the commissioner is unable to fill one or both of the legal requirements in public health law and mental health law, essentially establishing the same process for inclusion of the boards in the legislature, only with the department head leading that search rather than the county administrator if it's necessary. Otherwise, much of the language is the same, except with shifting to using the term whole health rather than public health or mental health. And we did modernize some of the language as well.
Thank you. I'll point out that this same resolution already passed Government Operations Committee unanimously. So it has to go through both. Any questions or comments before we vote? Okay, let's have a vote then. Mike?
Yes.
Randy?
Yes.
Veronica?
Yes.
And I'm a yes, that is unanimous. Thank you. And then so that was setting the public hearing. And then the next one is adopting the local law itself so that as soon as the public hearing happens, we can enact it when we're ready. Somebody want to move resolution to adopt local law amending Article 9 of the Tompkins County Charter to include the provisions of Article 16, effectuating the merger of the Public Health and Mental Health Departments. Veronica moves. Mike seconds. Thank you. Discussion? Okay, let us have a vote. Veronica?
Yes.
Randy?
Yes.
Mike?
Yes.
And I'm a yes. That is unanimous. That was easy. Okay. Next one up, resolution urging the state of New York to support an increase in early intervention provider rates to all disciplines by 11% to address the urgent provider capacity in the early intervention program. Somebody like to move that? Mike? Randy seconds. Thank you. Frank, do you want to set us up on this one?
Sure. So for those that aren't familiar, early intervention is our program for services for children 0 to 3 years of age that have developmental disabilities or delays. Our staff at the department coordinate services through many different types of providers, physical therapy, occupational therapy, speech therapy, and more, in order to help those children have the best outcomes that they can. Those rates are woefully inadequate, and it has really caused a challenge in maintaining and recruiting new providers into the program, to the point where there are times where there are delays for children getting into service because we just don't have providers available. So the state in the current budget year increased the pre-K services rates 11%. And those are for the children that are 3 to 5 years old, getting similar services through the school district. And so we really think it's important that the same rate increase is applied to early intervention as well. Otherwise, we're going to have an even larger exodus of providers and be unable to meet the needs of the children in our community. So we're asking the legislature to just essentially add your voice that we would like to see this increase for the providers.
Questions or comments for Frank? Go ahead, Mike.
I just want to say this is one of the few, not few areas. This is one of the areas where you best see their returns. It's really remarkable, early intervention. I'm glad Frank is asking for more money, to be honest with you, because I have heard the same complaints that during the pandemic, this was harmed. And I'm glad to see that we're kind of trying our best to restore this. Certainly has impacted my life, the county's early intervention, and impacted it for the best. So thanks.
Yeah. Anybody else? Yeah, I just wanted to mention this is part of a coordinated effort by other counties and other organizations and such, right? Should we? Is New York State Association of Counties involved in this too? Do you know, Frank? Should we add them to the list, or?
Yes, I believe they are.
Is any objection if we add that to the list of who to send the copy of this resolution to?
No, absolutely not.
Okay, got that. Thank you. Any other discussion? Veronica.
I'm glad we're doing this. This is important. Like Mike said, maybe I missed it. Is that 11% number like part that determined by someone else or part of this coordinated effort? Because it seems small, honestly.
Yes, the state sets the rate. We have to pay them. We share the burden of paying them with the state, but the state sets those rates. We don't have the ability to do it locally.
Right, but I mean, we're asking them to set the rate a little higher, right? That's what this is, at least partially. So I'm asking, where does the number in the ask come from, if you know?
Yeah, there's not really a mathematical number so much as just trying to equalize with the increase to pre-K services that occurred in the last budget cycle. I would agree, we would love that number to be higher. But as you can imagine, when advocating with the state, 11% is a big jump for them to begin with. So hopefully we can see this happen, and then in a few years, see it happen again.
Awesome, thank you.
Yeah, I had asked the same question actually, and I was just trying to find that email. I couldn't find it. It was based on some other programs and what rates they went up, and there was a little bit of math that went into it. It's not a precise number, not an exact number, but it's what they came up with. Okay, are we ready to vote on this one? Randy?
Yes.
Mike? Veronica?
Yes.
And I'm a yes, that is unanimous. Thank you, everybody. Okay, and then final item for the health department is, well, the one that's listed is youth mental health services. I was also going to ask if there are some updates like the opioid task force or whatever, but let's start with youth mental health services. This, we had a question by a legislator, wanted to hear a little more about this. Frank volunteered to talk about it a little bit at our meeting. Okay.
Yeah, and then I promptly passed it along to Harmony. So she'll be giving you the presentation, but just kind of started off. First, I want to thank the committee for their interest in youth mental health services in our community. It is certainly an area of need, and it's a place where we've done some significant investment in time and resources over the last few years, and actually have more built into the budget that you'll be voting on for 2023. So thank you for your interest, and I'll turn it over to Harmony to talk to you a bit about what's going on in the community.
Yes, thank you for bringing this topic up to the forefront where it deserves to be, since children are so important to us. I'm going to talk a little bit with you about our services that are offered through the Tompkins County Mental Health Clinic, and then also what services are provided through our single point of access coordinator, because that's an important person who really has a good understanding of what's happening with families and children who have more significant needs. So in the clinic, we serve children from the time they're born until age 24. So that's a pretty broad spectrum. We receive referrals from family schools, family treatment court, pediatricians, the hospital, and other social service providers. And we meet a broad range of mental health needs, from adjustment issues to serious mental illness. And we have a team right now of 5 psychiatric social workers, a child psychiatrist, and a nurse practitioner, as well as social work interns who can augment the services that are delivered by our typical team of clinical staff. And they provide mental health screening and early intervention to help identify mental health needs early, and individual and family psychotherapy, play therapy, and then another program called child parent psychotherapy. Our clinicians have all been trained in that model. It's an intensive treatment approach that's used for trauma and attachment. And we support children and families who may be involved in Department of Social Services who could benefit from that program. We also are able to offer psychiatric evaluations. Anybody that is getting medications, or a child or youth being considered for medications, would have an evaluation that's done by the psychiatrist. And we serve about 300 children, youth, and their families. Half of those are served right here at the clinic, and then the other half are served in a number of school satellites. I'll tell you our satellites. I always have to look at my list because it's long. We are in Newfield, Dryden, Groton, and Trumansburg school districts at the elementary, middle, and high school levels. We're also at the Ithaca High School. We're at the Boynton Middle School, and we're at the Enfield Elementary School. So we are in some capacity at all of these school districts, with the exception of Lansing. And our team is able to provide some home visits when it's appropriate to do so. So we are really out there directly where children are at. And we do see that there's a significant need for youth to get services in schools. We're hearing from schools that children are experiencing a lot of stress and anxiety and depression, and just really coping with socialization and expectations after such a long period of time when they were getting education in the home. So that's what we're offering at our clinic. And then Sally Manning, she's our single point of access coordinator. She gave me some information as well. The state about 20 years ago created single point of access services, or SPOA, in order for people to have a one place they could go to if they had needs that are greater than outpatient clinic services can provide, and trying having one person coordinate that support and services for people in the county. So every county has somebody like that. And she talks with all of the outpatient service providers, with the hospitals, with residential treatment providers, and really has a good sense of what's going on for families who may need more intensive services. And one of the services that families can get is called care management. It's really someone that can coordinate all of the services they can get in the community. And we have 7 care management agencies that work in Tompkins County, and they have about 20 care managers. And they serve about 80 to 110 youth and families at any given time. And of those 7 care management agencies, 2 of them are able to provide services to non-Medicaid youth. And that totals out to about 8 slots. So not a lot of slots available for care management for youth who are not, do not have Medicaid. And right now there's a wait list for about 5 youth who really need to get those services who do not have Medicaid. Then their care management services can make referrals. There's been 10 referrals for care management that Sally's received in the last 6 weeks, and 2 of those were for non-Medicaid. And that's an increase in seeing people reaching out to her saying, I really could use some support and help with someone managing all of the care and services my child needs. We have excellent care managers. They really go above and beyond because some of the services that they can send families to have pretty significant wait lists. So I want to let you know a little bit about what those in-home supports are and what kinds of wait lists we're seeing with those programs. So there are 2 programs that are designed to provide in-home intensive supports. The one is called Children, Family Treatment and Support Services, or CFTSS. That's a prevention-oriented program. And the state really expected more people to be able to get access to that program, but there are significant workforce shortage issues and reimbursement rates that make it challenging for agencies to hire staff at competitive rates. And then the second one is home and community-based services, and that's more intensive for children who have more significant needs. The design of these programs was to keep children from needing to go outside of the community, like into a residential treatment facility or hospitalization. They're really designed to really wrap supports around a family, so they're comprehensive in nature. There might be respite supports that are supposed to be built into these programs. People coming right to the home to provide therapy, skill building, and those sorts of things are what's supposed to be offered. But we have less than 10 youth who are getting the children, family treatment and support services in our county, with a wait list of about 20 to 30 youth. We also have only 3 children getting home and community-based services, and those are the children who really have significant needs in our community. Now, these programs were designed about 6 years ago. From Medicaid redesign, there was a real big effort in New York State to try and find a way to better serve children and families, so they redesigned the services. So we used to have about 20 families being served at the highest end at those intensive services, and now we only have 3, and there's 9 youth on that wait list. So as a result of not having these more intensive community-based programs, we have more children getting referred to residential treatment facilities. So those are programs that are licensed from the Office of Mental Health for children who need longer term, typically 6 months or longer, residential placement outside of the home. So Sally has completed 4 packets for those in the last, that level of care in the last 3 months, and has 3 more that she's in the process of completing. So in the last 3 months, there are about 7 requests. In a typical year, what we typically saw was a 3 to 4 in an entire year. So a significant increase in youth with really high level of need. And there are many requests for respite services. Tompkins County does not have any respite services here locally. We send youth either to Binghamton or to Elmira, which can be difficult for families with the transportation challenges that can create for them. For youth 10 to 18 and youth younger than that, there are really not a lot of good respite options. The one thing that we have in our county that many counties do not have is Cayuga Medical Center has a children's unit. It holds 6 children, it can sometimes, if there's a need, they can increase that up to 8 with Office of Mental Health approval. And they serve children 12 and above. And if a child is under that age, they would need to go to typically a state facility like Elmira Psych Center, upstate Hutchings. And then there's some other agencies hospitals that can provide that service, like Four Winds, that are nonprofits, if they need something more. So our hospital is able to offer short-term acute hospitalization services. But as you can see, if you're discharging, it's pretty challenging because some of those more intensive supports that are needed are in short supply. So one of the things that we've been doing, we recognize our gaps, is the Collaborative Solutions Network. It's our system of care in Tompkins County. It's been around for a number of years. We were able to get some support from the Office of Mental Health this year and do a gap analysis. We had about 30 providers in our county come together from across all sectors: recreation, Department of Social Services, probation, school districts. Anybody who works with children got together along with parent and youth voice to go through a process of identifying where our needs are and create an action plan. So it looks like a strategic plan of what we need to develop. And we're looking at trying to identify some funding opportunities to help meet both the needs at the intensive level of services and also at the prevention level. How can we make sure people know how to get access to services? How can we make sure we're doing good screening for youth? So we do have an action plan. Our next meeting, we have OMH coming this Thursday, and they're going to help us with the sustainable leadership model for our Collaborative Solutions Network so that we can implement that plan. So we're aware of the challenges people are facing, and it's not unique. The things that I'm saying to you, they don't sound, good in the sense of the lack of services. And unfortunately, this is a story across New York State right now. It's unfortunate there were these changes in design for delivery of services, and then we had COVID on top of that. And the state knows that this model's not working as best as they had hoped it would. And then you add this workforce shortage on top. So it is creating a lot of challenges, and we're looking for some creative solutions. So if there are any questions about that or other topics around children and youth, I'm happy to take them.
Harmony, thank you for all that dense and slightly depressing information. Randy.
Yes, thank you, Harmony and Frank. That was quite the education, Harmony. Appreciate that. It's very complicated, and I'm glad you're trying to get a handle on it. I'm curious. Do you have data on like the age groups that are having services provided by the health department now? Or I mean, is there like 50% of them from 10 to 16, or I mean, those kinds of things?
I don't have that today, but I could get that for you on what are the ages. I can tell you one group that does tend to come up is in discussions with all of the agencies that work with youth in our county is transition age youth. That's always a challenging time when youth are moving into adulthood, and there tends to be a gap in services. And also middle school age, an area I'm hearing people say there's from just talking to other providers when we have these system of care meetings, that seems to be the areas that they had identified.
Okay, thank you. And you mentioned an action plan. Could I get a copy of that? Just kind of curious to read through it.
Yeah, I can get that to you. Be great for you to see that.
Veronica.
Yeah, thank you, Harmony. I have so many questions. I'll try to only ask a couple. Can you clarify what respite services are?
So there's two kinds of respite services. They can be planned and they can be crisis. So sometimes a family who has a child with significant needs may just need a few hours that are planned. for them to maybe go shopping or just get away, and the child has an experience maybe with a small group of other children for a few hours, something like that. They can be overnight planned respite, like maybe once a month. So the family who is often feeling pretty, overwhelmed because of the needs of the child may have a planned opportunity to get away. And then there's crisis respite services. So sometimes a child just might be in a situation where people need time and space, and having a place to go for a few days, have some family therapy, come up with some solutions for the family so that they can get back together, add some supports in there. That's another form of crisis service or respite services that's available.
Awesome, thank you. And maybe I should know this, but what do these services cost for the people using them, like money-wise?
So the services, since they're typically through Medicaid dollars, they're not a cost to them. One of the ways they changed them is they used to be all put together a bundled service, and families could pick from a menu, and then they really unbundled those services and made them all billable, but they're billable through insurance, through Medicaid, typically, except for the few that are non-Medicaid.
Do people run into issues with Medicaid denying this or that service like you would with a private insurance company?
I don't think that's the issue. It's more that the rates of reimbursement make it challenging for agencies to be able to hire staff at the rates they need to make it, attractive. One of the interesting parts of it is the billable service. They're in the home or they're in a community setting, but they don't pay for the time that your employee would be traveling on the road. They pay for mileage and the time they're providing a service. So if you offered a service and the person didn't show up for whatever reason, a family in crisis, you don't get any reimbursement for that. You don't get any. So it makes it very challenging for agencies. The state did increase those rates a little bit, but they're not sufficient enough for people to really attract.
Okay, thank you. And I don't really have a sense of what proportion of kids in the county are covered by Medicaid, or kids that might be considering using any of these mental health services. I don't have a specific number I'm asking for, but can you give me whatever information would illustrate that?
I know in our clinic, we're about 65% that uses Medicaid. I don't know if that would then translate that that's the population of youth in our county. And it does sometimes become a challenge because if you don't have Medicaid, you have fewer options available to you. A lot of these programs, I think initially were starting using Medicaid funding, probably with a plan to expand, but it hasn't happened yet. So that can be a challenge for people who do not get Medicaid.
Thank you. I'll leave it for now.
Any other questions for Harmony? Harmony, thank you again. Yeah, you gave us a lot there, so thanks for the education. Frank, I wanted to ask you if there was any updates on the opioid task force.
Yeah, so Shauna has gotten us the names of folks that are going to be participating. So we'll be reaching out to them in the next couple of days to find a time for our first meeting. So I'm expecting that to be occurring probably within the next week or two. Will be the first meeting.
Thank you. And are there any other follow-ups from last month when we had a whole bunch of stuff? Does anybody? No. Okay, Frank, anything else for us?
Nope, I'm good. Thank you guys for your time.
Very good.
Wait, can I ask a question? What are you all thinking about COVID these days? I know like the community spread level increased, and I know you said the guidance isn't changing, but I'm hearing just general concerns from the community about what the waves bring, and should we be doing something different with masking and such?
Yeah, so we did expect that we would see a bump here as we start to get into upper respiratory illness season. And we've seen in 2020 and 2021 around the same time of year, a bump as well. So it's what we expected. case numbers are hard to judge because so much of it is being done with self-testing. So it's really hard to know for certain. I would say that what we're reporting is not an accurate picture of the actual case count in our community because of that. The hospitalizations have really been the priority metric that we've been looking at. They did tick up a little bit in the last week or so, which is what pushed us up into the next level of the CDC data tracker. Those numbers have already started to come back down. And so hopefully they will continue to trend in that direction. There's going to be COVID. We've been saying this all along. COVID has not gone away. And we're likely going to see these waves as we continue forward through time. The guidance, the CDC guidance, when you move to medium, is to recommend that folks that are high risk and seniors wear masks when indoors. We've been recommending that all along. We didn't change that when it went to low from a local perspective. So that's why there's no change really in the guidance recommendations at this point. You know, as far as going the next step around requiring masking, we as a county have not required masking in a very long time. We've really been following state and federal guidance on that issue. And that's the path that we really are expecting to take moving forward, mainly because we've told everyone. I think everyone's aware of where the health department stands on you know, how you can protect yourself, vaccines being the number one way, including the new bivalent vaccine. And just to talk about that a bit, we do know that it is still a little difficult to get appointments in our local pharmacies. We are communicating with them weekly, trying to understand, you know, what the demand is. I think, again, that's a good sign because any county around us, you can get an appointment today or tomorrow. And I think it's just reflective of the demand here locally. We have not done the bivalent clinics, you know, ourselves, hosted clinics, because we are in the midst of back to school vaccinations. So we are holding clinics each week for children to make sure they're able to get to school. And we're also doing monkeypox vaccine clinics. So our resources are stretched pretty thin. I would ask if you're interested in this, please call the local pharmacy in your district and ask them, you know, what their approach is to trying to meet the demand locally. When we call, we get the local folks and they tell us they're too busy. You know, it's hard to know, you know, how or why they haven't marshaled more resources when the demand in the counties around us isn't nearly as high in order to meet ours. But that's kind of the story about where we are. Once we're through this initial school rush of getting kids vaccinated with their normal childhood vaccines, we will be looking to see where we are at that point and whether or not we have capacity to do our own booster clinics as well.
Great. Thank you, Frank.
All right, we are moving on to departmental updates. Frank, I assume that was your departmental update, or is it
Yes,
anything else? Yeah.
I've taken enough time. Thank you all.
Thank you. Let's go to JR Claiborne, Veteran Services.
Right. Good afternoon, everybody.
Afternoon.
Right. So for me, the big things we've had this past month, we had a welcome back cookout with Team RWB and Cornell Undergraduates Veterans Association. It was pretty good. We did it downtown at the Marcos Flats building. So I'm sorry, Marcos Flats Fields. So that was actually kind of a fun deal. I just had a weeks-long training from the state, just got out of that a couple of weeks ago on various topics, and I won't bore you with the list, but it was good stuff. And preparations right now are underway for Veterans Week. So I'll be going back to the full legislature with some things about that pretty soon. And lastly, we will be having our fall startup for Warrior Riders. It'll be starting Tuesday, the 25th. And lastly, I just want to give a special acknowledgement to facilities, Dana Dexter and Larry Sprague. For last month's POW MIA Watchfire, they brought over 4 boxes full of worn or tattered or soiled US and POWMIA flags, which we used to retire in the watch fire. So I just want to give a special acknowledgement to them for that.
Thank you, JR. Any questions or comments for JR? All right, thank you.
Thank you. Take care, everyone.
Two. Next up, Kip Kephart, DSS.
Hi, everybody. We have been pretty fortunate this fall that our weather has stayed pretty warm, but we're now entering the code blue season of sheltering. So we have been getting that up and running. We currently are already seeing 134 adults in shelter and 33 children. So numbers are up, and we are preparing. We've been working with St. John's and preparing for that season to come on. And then we also are getting ready for the November 1st opening of HEAP season this year. This year marks a change back to pre-pandemic HEAP season. So during the pandemic, we've been very fortunate that the HEAP season has been extended. It started early. It's pretty much almost run year round because of extended funding. That's really helped families. And I think we are already hearing from families that the wait for the November 1st start for HEAP is difficult, but we are trying to help people with early mail-ins and trying to support them in all the ways that we can, getting, getting information out to people and supporting people with other programs where we can. So those are the big things we're working on. There's a lot happening this fall with families relying on us. I think with economic challenges and inflation, we definitely are seeing the impact of those things.
Questions or comments for Kit? Randy.
Yes, thank Kit. I think you were talking about HEAP. Is that the heating assistance?
Yes, I'm sorry. I should have said that. It's heating assistance program. It provides heat to people, supports for heat, as well as supports for things like if a furnace needs to be repaired, that kind of thing, it will support.
And who qualifies for that? Is it based on an income level or?
Yep, it's an eligibility-based program, so it's based on income level typically household status, and then depending on whether you rent or buy, rent or own, will determine what specific things out of HEAP that you qualify for.
Is that information available on your website or?
It is. If you go to, I believe it's, I think it's mybenefits.org. You can find some information. I hope I'm giving the right thing. I'll look it up. There is some information on the county website about the HEAP program, but it is a New York State program. So it's available if you go to OTDA, the Office of Temporary and Disability Assistance, and then you search for HEAP. You'll also find information. I'll find the links after I'm off, and I'll put them in the chat box.
Okay, great. Thank you.
Any other questions or comments for Kit? Kit, I wonder if you could, earlier this year and throughout the year, you've been talking about some difficulty in filling positions and that you had a number of senior people leave over the last year or so. Any general updates you can give us about that situation?
Well, I wish I had good news. I don't. I know that I know everybody's working very hard at HR to recruit, and we are really we're doing some of that as much as we can to kind of promote the word out there that we have open positions. What I will say is that we're getting by right now. Things are tight. And we are definitely seeing the impact of very small numbers of people taking tests and therefore being eligible. So it is a challenging environment right at the moment. We have lost a tremendous number of people to retirement, and we're going to continue, I think, to see this trend for a while. So the people that are here and that are dedicated to DSS are working really hard. Many of them right now are working more than more than just their caseloads or more than their typical workload. So I'm grateful to everybody for really pulling hard right now to get through this time.
Saw a sign on one medical provider that I went to and said, "The whole world is short-staffed. Please be nice to those who showed up." And I've been repeating that one a lot, and I like that one.
That's the name of the game right now, for sure.
Okay, Lisa Monroe, County Office for the Aging.
Hi, how you doing?
Good, how you doing?
Good, thanks. Well, I'll echo what Kit said. So HEAP is our big program that we help DSS with also, and we've seen a lot of foot traffic with early applications and again, exactly what Kit said, people are concerned about the cost, especially older people that are on fixed incomes. It's going to be difficult with the rising costs. And Randy, there's information about eligibility for 60+ on our website as well. Let's see, high cap open enrollment starts today for Medicare. So that's a busy time for us as well. A lot of appointments and foot traffic. We also partner with Lifelong that provides counseling workshops and appointments as well. And the only other thing that I wanted to mention is that we're going to be having an upcoming screening called All the Lonely People. That is a film company from California, I think, is coming to, it's a social impact film about social isolation and loneliness. And we're presenting it. NYSOFA, the New York State Office for the Aging, and Association on Aging helped bring this to the communities. They're trying to screen this film and across the state. So we were chosen as the in-person site here. We're going to be having it at Ithaca College on November 1st at 2 p.m. And it will be streamed out to 4 other counties so they can view it remotely. It'll be streamed to Steuben, Chemung, Sullivan, and Herkimer counties so they can watch it. And there'll be a panel discussion and a Q&A after with the producers and Dr. Elizabeth Bergman from the Gerontology Institute. That's all I have.
Lisa, any questions or comments for Lisa? All right, thank you. Next up, Kate Shanks Booth, Youth Services.
Yes, hello. Yeah, good afternoon. Just a couple things. I want to thank the legislature for the proclamation earlier this month that that named October as United in Kindness Month. There's a series of events that are happening across the county to support anti-bullying, and it's a domestic violence awareness month. So we're working in partnership to raise awareness about those important issues. So thank you for that. Another big event that's upcoming for us, and we're really excited about, on November 9th, we're going to be having a municipal youth service event where we're going to be bringing all of our different rural commissions together, and we're going to be giving them a dinner and thanking them for their volunteering and their time, giving them a chance to network, share best practices, and really try to get a better sense of what challenges might be happening in Lansing versus in the field, and allow them to talk best practice and strengthen those bonds, and also give us some ideas of ways that we might support rural youth in partnership with those folks. So we're really, really excited about that. It's been over a decade, I think, since we brought them together. So we're really, really happy to be able to announce that. And Rick Albert has joined our department as the new coordinator for community youth services, and he's doing really, really well. So we're getting ready for the fall and excited for different things that we're working on. So that's what I have.
Hey, when you talked about that gathering, I was remembering, oh yeah, I went to one of those way back. I was on the Danby Community Council. So yeah, everybody talks about it at that event so memorably, and so we're really excited to be able to bring it back and just to say thank you, because they work hard every month to make it possible with what we do with the youth. So very good. Questions or comments for Kate? Okay, thank you. Is there anybody else up there from a department that I'm not getting to? Okay. I just want to say to all the department heads that are still here, you know, we've had these really packed Health and Human Service Committee meetings, and we've skipped the department updates on some of those. So, you know, thank you for being flexible on those times. And I'm glad that we have, you know, a meeting where we're not so overpacked that we can get to hear from everybody. Next up, advisory board appointments. We have to the Community Mental Health Services Board, we have Sally McConnell-Janae and Dorothy Lovelace. And to the Community Mental Health Services Board, Dorothy Lovelace. Is there anybody that would move those appointments? Randy moves, Veronica seconds. Any discussion? Let's have a vote then. Mike? Randy?
Yes.
Veronica?
Yes.
And I'm a yes, that is unanimous. Thank you, everybody. Next up is the minutes approval. So I did have a bunch of suggested changes I'd like to make, and I sent them out in advance, but I realized a little earlier today, I didn't send them all out. I'd written, for whatever reason, I'd written some hand notes and that didn't make it into my email. So how about, well, look, let's just discuss it before we move it and see if we can, I think we can do that. See if we can make these changes, and if we don't, we will, let me start again. Let's move the minutes, and then we can do these as formal amendments. I think it's just cleaner. Is there anybody that would move the minutes? Randy moves, Veronica seconds, thank you. All right, so I'll just dive into mine, and if anybody else has anything they want to say as well, too. So I'm on packet page 25 to start with. First one is easy. First line is just a spelling change. It's Dietz. Jerry Dietz is D-I-E-T-Z. I assume no one objects to that. The next page, packet page 26. You look at the paragraph, it's about halfway down, that starts with, in response to Mr. Klein. And then it goes on to say, adding that the goal of tides would be to minimize the number of individuals camping in unsanctioned encampments, but, and I'm going to propose that we stop right there and eliminate the rest of that paragraph and instead say, his office will not prosecute for trespassing. Did everybody get that? You don't have to agree to it, but I just want to make sure you're following along. Okay. I just think it is what he said, and I just think it says it a little better than I think. Okay, next page, packet page 27. The top line, Mr. Klein indicated, just add the word he. I think that's just a grammar thing. Next paragraph. Next paragraph that starts, Mr. Sigler stated his opinion. And then the next sentence is, he indicates one issue is with enforcement, adding that probation and other departments will need full access to, and I'm proposing that we change the words a program like Sunflower to their clients, so that it would read, adding that probation and other departments will need full access to their clients. Yeah, I just think it's a little cleaner and says what was intended. Okay, continuing down that page, a paragraph that starts, Mr. Klein indicated that we, the county, cannot, and I'll just keep reading, that we, the county, cannot act within the city as the land in question is within their jurisdiction. I would change within their jurisdiction to owned by the city. It says the same thing, but I think it's a little more accurate maybe, or. Okay, go ahead, Mike. Yes, actually, you're right. And that's why I want to change it, because it is owned by them. The fact that it's their jurisdiction is less important.
Okay, that's interesting.
Yeah, thank you. Okay, it's now packet page 32 we're up to. The first paragraph, a couple of sentences in, it says, Mr. Krupa stated, part of the issue is making sure we understand the funding before it is spent. And I just want to add in the words, the exact amount of funding, just to clarify. It's not really a meaning change, it's just clarification. I think those are all my changes. So are there any concerns about any of the changes I wanted to make? Veronica.
Yeah, thank you. The only one I have a concern about is the one on packet page 26.
Okay.
The one in the third paragraph about
Yeah.
what Matt Van Houten was saying. I am totally fine with adding the language you wanted, that his office will not prosecute for trespassing. And I'm wondering why you want to take away the rest of it.
Okay.
I will say, I'm asking without having like gone back and listened to the meeting. So I don't remember precisely what was said.
Sure, let me see if I can do that. So first of all, it says they do not have the resources to enforce not residing in those locations. I didn't hear him say that. I heard he says, I will not prosecute these crimes. I don't think it was a resource issue. It was a philosophy issue. Yeah. And then what else? Punishments for residing in encampments locally was discussed, as well as how people can be discouraged from living in the encampments and rather take advantage of housing programs. I mean, I don't mind leaving that in there. I just find it's a little vague, you know, and it doesn't really say much. It's not, so yeah, it's not a big deal, but that was my thought. Do you feel like that should be in there?
I would have to go back and.
I remember that discussion, but I don't.
Yeah, it's not wrong. It did happen. I'm just not sure. It's a little awkwardly said. I don't know exactly. You know, when I remember he did say we want to discourage people from living in the encampments. I asked how, if he has any ideas. He said no. You know what I mean? So there's not really any information there to add. But if you want it back in there, I'm fine with that.
I guess I would be on the side of putting that, yeah, that whole last sentence back in there then. If Randy, if you remember discussing it.
Yeah, okay.
Just that final sentence.
Okay, I do, the only thing that really did stick out to me though was the word punishments. I don't think he used that word. You know, and that's not, we don't really punish, we enforce. Can we change the word punishment to enforcement? Or, I don't know. Yeah, I'm not even sure what that meant, actually. Punishment for residing in encampments was discussed. Yeah, it's not a word we would have used, and I'm not sure exactly how to replace it. That was part of the reason, but.
Can you just start, excuse me, can you just start the sentence with residing in encampments?
That would work for me. Veronica?
Sure, yeah.
Hey, Mike, does that work for you too? Okay, thank you, Kathy. That was a good suggestion. So we're just eliminating the words punishment for. And then, yeah. Any other thoughts about the minutes? Okay, ready to vote then? Randy?
Yes.
Mike? Veronica?
Yes.
And I'm a yes. So that is unanimous. Thank you, everybody, for accommodating that. I don't spend a lot of time on minutes, except when it's my committee, then I guess I do read them. So, and that was quite a wide-ranging conversation. I just wanted to try to get it to be good. All right. Comments from committee members, liaison assignment reports. Okay. Did you have something, Veronica? I wasn't sure.
Just because we're so early and I feel like it's not that bad to waste time. I know we already voted on the minutes, but now I'm looking back at the video and seeing what I can get out of the closed captioning. And I do see Matt Van Houten specifically saying we don't have the resources to prosecute people camping on public land. Doesn't mean that everything someone says has to be in the minutes. Just wanted to note that.
Okay, thank you. If you want to add it back in, I guess I don't have an objection.
Is this conversation going to be in the minutes of this meeting? Are we just going to have like a nested minutes discussion?
Up to the minutes taker. Okay with me.
So to clarify, could we just read exactly what you'd like that paragraph to read?
Sure. And before we even do that, what is the process, Kathy, for amending the minutes after we've already voted?
I would allow that if the committee comes to an agreement on wording for that paragraph, we'll have the minutes reflect that.
So, okay, we're back on packet page 26. So Veronica, you go ahead and say what you'd like to see.
So I guess that I would suggest keeping it at like starting from where it says adding that the goal of tides would be to minimize the number of individuals camping in unsanctioned encampments. What? Oh, sorry. Adding that the goal of tides would be to minimize the number of individuals camping in unsanctioned encampments. But his office will not prosecute for trespassing, partly because they do not have the resources to enforce not residing in these locations. And carry on with the last sentence as it is written.
Tyler, did you get that wording? Thank you. Does committee members feel good about that? Accept that? Okay. Kathy, shall we vote again or no?
No, I think that's fine. It'll be part of the original amendment.
All right.
Thank you.
Welcome. Okay, we are up to comments from committee members, liaison assignments. Okay, the next one is goals review. One of the committee members asked to see the goals again so that we could, check where we're at to see what's left that we haven't gotten to. So if you want to take a look at packet page 36. This is the list of goals that I found from the beginning of the year. I hope it's the right version. I have a bunch of versions on my computer, but I think this is the right one. So I don't know, should we take a minute to go through it or does anybody just want to comment? Yeah, go ahead.
Homelessness.
Yeah.
And under the goals,
Yeah.
we will monitor the issue of homelessness, hear updates, and consider use of recovery, community recovery funds to address housing. And although we put something in the budget for 2023 for a homelessness coordinator, I think is we call, who's to say that we're not going to use other funds? I mean, is it just going to be community recovery funds that we're going to address this issue with, or?
No.
I know we didn't put any specific funds in for that. And we talked about that and we said that we're not planning to do that in this year's budget.
So we always have the right to recommend, funding for a program if we want to do that. I threw in the community recovery fund things because as of January, we didn't have the rules yet. We didn't know what we were going to do with that program yet. And so both in the homelessness and in the childcare one, I said, we can consider also using that fund, finding organizations that want to apply for that money to address this issue. So that's why I put in there as an extra thing. And as, in my opinion, as the course of the year went on, that was a little bit discouraged by our chair, but also it just sort of didn't happen. There were no, I know organizations thought about, and maybe they still will because we're not done yet with that, but I don't know. Did that address what you were asking? I'm not sure.
Yeah, I guess, we don't know what's going to happen with tides or whether it's going to come to fruition in 2023 or not.
Yeah.
So I guess it's just a goal. It doesn't matter. So it's going to come to discussion, I think. So
Okay, yeah, I just wanted to bring in that we had another funding source and, consider that. And I'll mention it too. So that is one that when I reread these, I was like, oh yeah. I had put something in there for the childcare issues too. And there was interest in a large ask of the recovery fund. And it turns out they were not eligible, the ask that they were, the several $1 million that they were planning on asking for because it's ARPA money. There's a whole bunch of rules and it was going to be the Child Development Council asking on behalf of childcare agencies, and that doesn't work with ARPA. So that whole ask fell apart. Whether those childcare agencies themselves will directly reply, we don't know yet. I don't know yet at least. Looking through the rest of these then. We did spend several meetings, some very long discussions about homelessness. We did have the childcare presentation to us, and that was one of our themes of our meetings. We did spend some time in the opioid settlement last month, especially. Cannabis, nope, nothing's really happened with that, and no demands have been made on the county yet, so nothing with that. COVID, we just asked about it, but this committee is not being very involved in the COVID response at this point. Home health aides, we did spend a meeting having a big presentation about that, and I intend to check back with them over the next few months to get an update. We had just hired somebody new for a new program for home health aides, and so I'm interested in getting an update on that.
I have a question on public health, and I'm not sure where this fits or if this should be in there at all. As we went through COVID, a lot of discussion was had on do we have enough beds or ICU beds or ventilators? And I don't know if we have any data on that. Did we come close to running out or? So just thinking about that as a goal to understand where we ended up would be important. So
okay. I would encourage you to actually reach out to Frank directly and just ask him, if you can provide a little information about that. Having been in the legislature at that time and getting those reports, those very thorough reports at every legislature meeting, my memory is that we did not get very close to that crisis point, that we had good backup systems, that it didn't hit that hard here in the beginning. And that we're kind of beyond that at this point. That's not the.
I will reach out to him.
Yeah.
The only thing I heard is that the emergency room services were overwhelmed.
Okay.
For
yeah.
obvious reasons. So.
Yeah. So I'm sorry. I was just giving you my memory of what we did at that time. But feel free to ask and share it with us. And what we have listed here as goal is keeping track of the public health and mental health department mergers, and that's been going on the last couple of meetings. So we're on that as we need to be. And that was kind of it. There was a couple other items in there that explore how we can increase providing DSS service to those eligible. We haven't really tackled that as a direct topic. The overdose deaths, we haven't really tackled that as a direct topic. Although I've seen some email traffic about that.
Yeah, well, Jen Olin sends out a report every month, and I know we still had discussions, and I can't remember if it was this committee or public safety, or both together, about like the accuracy and inaccuracy in counting. But I would say we'd have had movement on that front.
You're right.
And maybe this merges down into the opiate task force that's going to start.
You're right. Thank you for the reminder. I do remember at our joint meeting with public safety that this topic did come up, and our undersheriff did speak about this. Yeah. And then enforcement on the ban of sale of flavored nicotine products. We did have a presentation about that at the beginning of the year. And I think we got one follow-up report, if I remember correctly. I've seen an email report. So I don't know. I think we did pretty well on our goals. We still have a few months left. We're going to get the housing, the other side of housing next month, which is the non-homelessness, some of the other issues around housing. Veronica?
Yeah, I'm also I was happier than I expected to be reading through the goals and thinking about what we've done this year so far. For the ban on the sale of flavored nicotine products, I know we talked about that a while ago, and then I just, and I should have followed up, but emailed from a constituent who works and I think like has kids who go to school downtown and is concerned about the like advertisement of flavored nicotine products once again, which maybe now this is not the time to talk about this because we don't have Frank anymore, it seems, but I guess I would love an update on how that enforcement is going on through the health department, because it sounded like they had a process and were doing stuff, but it was also kind of a new thing at the time when we talked about it in the spring. I don't remember.
Yeah, it was early in the year. Yeah, my memory, I don't think it was a new thing. It was just that they hadn't really done it during COVID. They had other things on their minds and they were resuming the enforcement processes. That's how I remember it.
Okay, maybe you're right.
But either way, yeah, it's the same thing. So yeah, we can get an update. Absolutely. Let me write that down.
And then, yeah, I don't think we've really have we touched the goal about explore how we can increase providing DSS services to those eligible? And do we want to? And I'm wondering if Kit's still here, if has any comments on that?
I'm still here, and I think that that goal is one that we can certainly talk more about. Dan and I had discussed it when it came up. So that's a little bit tricky. And we had talked about it. I think that the concept of trying to increase the number of people that are eligible is kind of working in reverse from the way that DSS works. We are a service of applications, so people have to come to us to apply. We certainly support all of the state promotion of our services that we can, but I'm not sure the way that goal got listed is really something that DSS can do. It might be something that the county wants to do differently and separately from what DSS can do in terms of promotion.
Okay, well, I'm not totally sure I'm understanding it then, because I hear you that you at DSS, you can't do anything about expanding who is eligible for services.
Right.
But I had thought we were talking about like under the current eligibility requirements, getting more folks who are eligible for services to receive services. I know I don't know if it was that. I know I hear about like in certain programs like SNAP or like, I can't remember how childcare assistance is called. There's like, there's money left behind that could in theory come into our community, but it doesn't because it requires like all of the certain individuals to go through the whole application and whatnot. So
we have definitely this year, we have definitely promoted the childcare program. We have done that. We have done that under direction and support of the state. When it comes to SNAP, SNAP is a program that the FTA or the FDA, they are the ones that promote it, and they do that mostly through Cornell Cooperative Extension. So we are a service of response. So when people come to us and request, services like SNAP, we are responding to them. We don't have a way to go out in that program, and in most of the programs that we run, we don't have a way that is outside of the direction specifically of what the state does to go out and like promote, hey, why don't you come apply? Other than what currently exists. So I'm not sure what is listed in that goal is entirely possible for us. There may be ways that the county wants to encourage through like private agencies, wants to encourage additional promotion of programs, but we are somewhat limited in terms of what we can do other than under the direction of the state or feds.
Okay, so maybe the goal isn't for you to do anything different, but it's for us, the committee, or I don't know, and other agencies to draw on your expertise and knowledge and like other things to figure it out. I don't know if it's a conversation for later or ever or what, but it seems still important.
Well, I remember, having that conversation with you in January, Kit, and, kind of puzzling about it ever since, or, at least to some extent, and I don't really have like a list of ideas in my head of how to address that issue. So I'm not even sure where to start. Not sure how to, so I'm looking if there are ideas of how to move this idea forward, then I'm all ears. Okay. No, I don't mean today. I don't mean this moment. Okay. Anything else about the goals? All right.
Wait, sorry, I had one more thing about the goals. Under the housing, one of the things says we will explore the idea of a wet shelter and or a youth shelter in Tompkins County. And I don't know if we did that or if we could bring that up at our discussion with Elliot, even though I know that's a different corner of housing in the future, or if Kate has a comment.
Yeah, not necessarily formality through the group, but we did early on, it's been a few months ago, look at the possibility. It was right at the end of after the budgets were submitted last year, look at the possibility of a possible youth shelter, but the timing and the regulations and everything, it didn't line up as far as timeline goes. We were very fortunate last year to have just short of $2 million come in from the HUD funded Youth Homeless Demonstration Project. 2 of those projects have been selected. One would be one through the Village of Ithaca, which would the idea is transitional housing to help with youth. Right now we're having conversations around how that will open and how that will best serve minors and then those over the age of 18. And then the Learning Web is also the second recipient of the YHDP funds. And I do believe they're looking at a scattered site with 16 beds. It'll be permanent housing, which is a little bit outside of what they typically have done historically. But I think they've acquired one of the 16 units at this point, but we're looking to make sure that as we're walking through that we're keeping a focus on rural youth as well, because we know that looks different and transportation is an issue and all the other things that come with that. So there has been, we also did receive some additional funds from the county to reopen the Open Doors program. And that has happened. We're fully up and staffed. We are currently waiting, unfortunately, on an operations license from the Office of, it's either caught up in the Charities Bureau or they're waiting on an IRS letter to be able to do certification for host family homes, which allows that respite. And so that is happening. We're pending. So there's been a lot of stuff going on with youth homelessness. Still a challenge, obviously. We're still in much need, but we're working on it. So a little bit of an update for you.
That's awesome. Thank you.
Yeah.
Yes. And as far as the wet shelter, it is true. We haven't exactly tackled it head on, and we certainly haven't come up with a plan. I keep thinking that as we talk about tides or whatever version of things that's going to be, that is going to be part of the discussion, right? Is it a wet shelter or facility or whatever the right word would be, to be determined? That's where I think it's going to come up.
Yeah, I agree. It's related. I think Megan put something in the chat about this and I missed it. Can someone read it maybe?
Although our office hasn't been involved in wet shelter conversations, I believe years ago, the Continuum of Care Homeless and Housing Task Force was talking with another community who had such a shelter. So there have been some community discussions about it. If anybody wants to follow up with them, the community Continuum of Care, we could maybe get some info. Okay. Anything else from goals? All right. We have all those informational budget adjustments, et cetera, et cetera. And is there any other business for this committee? In that case, we are adjourned. Thank you, everybody. Nice to not